Hi, I'm Jamie Korf. I am a deputy editor for Minneapolis.St.Paul Magazine. I have the privilege of being the host for this wonderful monthly series, Wellness Wednesdays. Um, I'd like to extend a resounding welcome to those among us who are tuning in for the first time, um, and a resounding welcome back for our repeat watchers. Um, it's summer outside, but it's fall in my heart. This is pumpkin spice tea. Anyways, I saw someone on social media say that if August were how did it go? August is like if Sunday were a month. And while I understand the sentiment, really can't wait for fall. But days like today are what is getting me through. We have so many exciting things in store for today's Wellness Wednesday. Excuse me. It's called Where East Meets West at the Hospital. As you know, those of you who have tuned in before, we have spoken to Eastern medicine doctors and traditional Chinese medicine practitioners from Northwestern Health Sciences University at length. And this time we're shaking up the format a little bit. So we will still be bringing in one of Northwestern's finest, but we'll also be talking to a doctor from our very own Park Nicollet, who will be representing Western medicine today. Super excited, you guys. This is going to be a great, enriching conversation. So combined between Barbara and Jane, their knowledge, expertise, and experience will showcase, just how integrative medicine has evolved in recent times, from acupuncture in the emergency room to chiropractic care in inpatient facilities and so on and so forth. As we know it, and I am going to be kind of speaking in broad strokes here, but doctors have been, historically a little bit more prudent when it comes to changing the foundational principles of Western medicine as we know it. But as research comes out, we have more access to our information than we ever had in this digital age. We're learning that patients are really exploring and kind of challenging the boundaries of Western medicine a little bit, and even to the extent of persuading their care providers, to integrate Eastern medicine into their comprehensive care plans, that's huge. We've come a long way in the past 20, even 10 years. And we're getting to a point where physicians can't disregard or look away from how non-traditional medicine can impact their patients. And so far, it seems that integrating those practices into a traditional healthcare delivery system, that model seems to be working. And there is a wider acceptance of integrative care, complementary medicine, whatever you want to call it, happening within the hospital and clinical environments. But we, of course, have a long road ahead of us yet. So today we'll be covering how both worlds, Eastern, Western, are making strides and becoming more united, more integrated, what that looks like on a logistical and idyllic level, along with popular examples of integrative medicine, what's in store for the future, which age groups are leveraging this the most, and so on. But before we start from the top and I bring in today's guests, I just want to do a little shout out to Northwestern, all the cool cats there. We love them. We've been partnering with them for 3 going on 4 years. We've learned so much. Northwestern Health Sciences University is based out of Bloomington. They're the leading chiropractic school in the Midwest. There are so many cool factoids about this place. I mean, they have the largest herbal dispensary in the Midwest. They train, pro sports teams there, and it's a hidden gem, truly. And so they offer all sorts of degrees in natural health. Their clinic is open to the public. They offer natural care services like cupping and acupuncture, Chinese medicine, massage therapy, of course, chiropractic, and so much more. So one quick housekeeping item before we jump in. Be sure to drop all of your questions in the comments or the Q&A box, and we will do our best to get around to all of them. As I was explaining to our panelists today, we We strive to make this very conversational in nature, and we want this to be viewed as kind of a virtual classroom. We're all learning from each other. So jump in, chime in at any point. And so with that, let's get this show on the road. Today we have Dr. Jane O, an internist who practices out of Park Nicollet, and we have Barbara Gosse, an associate professor at the College of Acupuncture and Chinese Medicine at Northwestern Health Sciences University. I'd like to welcome both of you to today's session, and thank you so much for lending us your gift of time and expertise. Hi, Jane. Hi, Barbara. So I introduced you to, I barely skimmed the surface. So if you wouldn't mind starting with Jane, just, please share with the audience who you are, what you do. And of course, we always want to get to know you on a level outside of your profession, what you enjoy doing in your off time.
Sure. Hello, everyone. Thank you so much for inviting me. Thank you, Barbara, and thank you, Jamie. My name is Jane O. I'm an internal medicine physician. I practice primary care internal medicine for Park Nicollet. I also do hospital medicine, and I recently have transitioned to working in the hospice at Methodist Hospital. So I have a great interest in lifestyle medicine. I'm board certified in lifestyle medicine. I also have a great interest in mind-body medicine. So the integration of mind-body medicine, meditation. I have been trained in stress management and resilience training through the Benson Henry Institute of Mind-Body Medicine at Harvard Medical School. I also am a yoga teacher, so that's actually what started me on this whole journey of learning more about healing outside of Western medicine through yoga. And so I have taught yoga for several years. I enjoy hiking, biking, jogging, yoga, anything that moves my physical body outside, and walking my dog. Thank you.
Hi, everyone. I'm Barbara Gosse, and thank you, Jamie, for inviting me, and nice to meet you, Jane, as well. I am a practitioner of traditional Chinese medicine. I've been a practitioner for almost 30 years, and my initial goal with finishing school and starting clinical practice was actually to start in a hospital system with the intent of influencing the way medicine is dispensed in this country. So I started my career as a Chinese medicine practitioner at Hennepin County Medical Center and worked there for 13 years, and then moved 100% over to Northwestern, where I helped initiate the hospital-based programs where we do our clinical internships with students. And outside of my clinical practice and my teaching practice, I have changed my living from a big old house in the middle of the city to a condo in the city. And so my excitement for the last 6 months has been decorating, undecorating, selling, packing, moving, and redecorating. And I just came back from a lovely camping trip this weekend with family. So that's a little of who I am.
Sounds lovely, Barbara. So you said that you started at HCMC, is that correct?
I did.
Okay.
Mm-hmm.
That's quite a coincidence because I did my residency training there. Yeah, so we may have crossed paths at
we
some
may
point.
have.
Small world, worlds collide. Barbara, since the onset of your career, how have you, you both have such interesting backgrounds. I know you've seen so much. You've been at the forefront of trends and, evolving practices, even the narrative around different medicines. I wanted to ask you, and then I'm going to ask Jane after, how have you personally observed the evolution of Western medicine kind of joining the forces with the Eastern world?
Well, of course, it's multifaceted, right? In the beginning, in 1993, when I started my practice, I believed that we were the first hospital-based structure in the United States. And since then, hospitals from across the country have started to hire and integrate if you will, traditional practitioners or non-Western medical practitioners into the system. And also teaching internships within the system. And that's really quite a change.
Jane, would you kind of mind weighing in on your observation as well? Like, how have you witnessed the shift in kind of the collective perception around Western and Eastern sort of more being united and integrated in care services?
Yes, I think what we recognize as practitioners is that our patients really want more, other techniques other than just medication, hospitalization, surgeries to treat illness, but also they're very interested in how to stay healthy. And so the great thing that I see about integrative medicine is really being able to teach people how to be healthy and stay healthy before they get sick. And so that is, I think, where we're starting to, Western medicine has been a little behind in this aspect of preventive care and staying healthy. And what I see is my colleagues are getting more interested in that whole aspect of staying healthy and integrating other techniques other than just medication, surgery, et cetera.
Jane, do you feel like the patients that you've seen or that you've treated, I know it sounds like you guys are trying to, that whole realm, that whole field of medicine is trying to be more proactive in how you approach care. Do you feel like that's coming from the patients, that's the influence of the Eastern medicine world, or maybe a little bit of both? And I'm wondering that because, and this is purely anecdotal, and I think I've mentioned this on a Wellness Wednesday before, but I just wonder, it seems that more people are being kind of more empowered in their journey to wellness and leading a healthy lifestyle and not just relying on other people to tell them this is you got to take this, that, and the other thing. They'll do that, but they still want to feel like they have control over their own bodies and what they put in them, feeling good about what they've done, how they've moved their bodies, things of that nature. But just wanting to know what kind of the larger conversation looks like around that.
Yes, absolutely. I feel that this is really coming from the patients and the clients. Would you agree, Barb, that that's what they want? So
I think it's in part that, and I think another part of it is our shift to patient-centered care. And a component of patient-centered care is really teaching patients or individuals what is their best health from where they sit today or where they're coming from today, and really encouraging that along.
I would agree with that. And really empowering, the way I see it is that you're empowering people to take charge and take ownership of their health. Right. So rather than just like a paternalistic way of looking at medicine is, the medical doctors were the authority figures who told you what to do. Instead, right. People really wanted to, take charge of their own health. Right. You see that with the fitness, the fitness movement, all the different kinds of health diet stuff that's going on, interest in acupuncture, interest in other kinds of modalities that are outside of Western medicine, to be healthy and to be the best they can possibly be.
Yeah. I spoke to just a whole roster of Western medicine doctors from leading institutions and clinics across the greater metro area over the past several days about different specialties in women's health. And the commonality, I think I spoke with maybe 6 or 7 different doctors, was they came to me and said, this is how a woman can be empowered. These are the kinds of questions that she can bring with her. and this is knowledge she can arm herself with before she even sets foot into the clinic. So she feels like there's a sense of accountability there. And like you were saying, Jane, kind of more of this take charge mindset. And I just thought that was really striking. I think there's a big sea change happening right now as we speak.
I would agree.
I think also promoting that patients develop their own toolbox of health, and toolbox of self-care is very important. So we're in a position where we actually have the ability to do that with patients.
Absolutely. Yes. And I love the way you put that, Barb, with a toolbox, because I've often thought of that metaphor of, just having tools that people can call upon without having to look to someone else. What can you do when you're feeling stressed? What can you do when you're feeling anxious? What can you do when you're having trouble sleeping? And then they have these things that they've learned, tools that they can actually pull out of their pocket and use. And it is very empowering for people to have that. And I think it takes the burden off of us as practitioners also we're not the ones, we don't have all the answers. We have a certain skill set that we can help people with that is very important, but they're ultimately in charge.
Right. If I can just weigh in with one more thing here, you guys I've got so many things kind of like just flashing through my mind, but I spoke with a sleep medicine doctor from, I think it was Alina. And she told me that, and I'm going back to women's health again, that there are all these sleep conditions that are so often rooted in the picture of, middle-aged white men, but that women are actually experiencing insomnia and sleep apnea at higher rates. And she said, you don't have to live with this. You don't have to just write it off and be like, I'm a working mom, I'm tired, of course, or I'm a caregiver, I take care of my family, I take care of my parents, of course I'm tired. You know your body well enough to know if you are kind of that next level fatigue. And she said, of course, we're here to help you find a solution and to kind of land on whatever that diagnosis is and then build a treatment plan around it. But it would be even better for both me and you to, put together a sleep diary and be really detailed. And, instead of just saying, I'm really tired, I feel run down. Well, I'm noticing that I go to bed at 10 p.m. every night, but I don't fall asleep till midnight, or I go to bed at 10 p.m. and I wake up every 3 hours. That those are the things, like, you just need to be really detailed, specific, and as transparent as possible, because we have the answers, but it might take double the time to get to them, because we need you to be super familiar with yourself, is what I'm trying to say, and confident in the information that you're sharing. Okay, so with that, Barbara, if you wouldn't mind kind of sharing with all of us, we talk about acupuncture in the ER and inpatient facilities and things like that. From your observation, from your tenure, what have you observed as kind of the most popular examples of, I don't know if you want to call them CAM, complementary medicine practices? And can you also kind of give us a little primer on their respective benefits as well?
Okay. Well, so that's been a long process in the hospital system, right? And Chinese medicine was probably the initiator of bringing CAM medicines into the hospital system, along with came massage therapy. Later on down the road came chiropractic medicine. And each of those labels of medicine have multiple modalities within them that are used in different environments in different ways. So, for example, in the hospital, in an adult department, doing acupuncture is actually very effective and easily dispensed. Whereas working in a pediatric hospital where I work right now, you can imagine that a very sick child does not want to have somebody come into their body space with more needles. What they want are softer, gentler modalities. And fortunately for children and Chinese medicine, it's easy to have a big effect with a little tool like a tuning fork or a laser machine. So what's the most effective is variable depending on the condition of the patient and the preferences of the patient. So a chiropractor in an emergency room addressing an acute torticollis or maybe a chronic back pain, right, would be a very effective treatment, as would acupuncture in an emergency room in that kind of a situation. So, and massage therapy could be utilized in all kinds of different situations, using caution for somebody who might be neutropenic or somebody who has low platelet counts. You know, you want to be careful about the kind of treatment you dispense in a hospital system, which is probably one of the biggest topics of training that I do with students. You know, they all come in understanding what their medicine is and really gaining practice in it. What they don't understand in the onset is, what do the lab reports mean and how do you adapt the treatment to what the lab reports state?
Jane, would you also mind weighing in on some of the modalities that you've seen maybe just surge in recent times from the conventional medicine standpoint?
Yes, well, I have been interested in the whole role that lifestyle plays in health. So it really is like the basic things of healthy eating, exercise, sleep, the importance of sleep, the importance of a positive mindset and positive, and how your thoughts contribute to the way what happens in your body. So I think I see people really showing more interest in that. And when I worked in the clinic, I would often, when someone would come see me with anxiety, if they were open to it, I would talk to them about meditation and refer them to some apps they could try for meditation. When they were dealing with insomnia, besides referring them to a sleep specialist for evaluation of their sleep and seeing if they have sleep apnea, I would also talk to them about the sleep hygiene. You know, are you staying up late at night looking at your screens? How late do you have caffeine? You know, those kinds of things that really can affect sleep, and how to get your body into a relaxation mode. So, and there is a lot of research showing that if you practice healthy lifestyle through sleep, diet, exercise, that you can have better outcomes in some of our chronic diseases like diabetes, hypertension, heart disease, and even symptoms of things like menopause.
Dr. O, so is this something that you have just slowly, kind of these more lifestyle medicine principles, are these things that you've slowly instilled into the way that you evaluate and treat your patients? And also, have your colleagues been sort of following suit? Have you noticed them doing the same instead of just, here's a medication, here's another doctor, here's another specialist? Are you noticing that there's more of kind of this, I don't know, proactive, sort of a reactive approach after? I mean, that's hard to say because when they go in to see you, of course, that's a reactive thing, I'm sure. But, you know, just for kind of the future, for future reference, try this, that, and the other thing.
Well, I think that over the years, I have learned the people who are interested in these kinds of things and opening a discussion with them, and introducing ideas like meditation, exercise, healthy lifestyle. of course, in all of my practice, I always talked about healthy lifestyle and how important that is. As for my colleagues, I wish there was more openness to it. I would say there's still really a barrier to people, to my colleagues being open to this, simply, I think, because they're feeling really overwhelmed right now with the pandemic. And there's so many other factors that are affecting the practice of medicine right now that one more thing is not, they're just not open. But there are certain kinds of practices that are open, like pain management.
Sure.
People who work with chronic pain, they're very interested in integrative therapies.
Right. Right.
So there are certain segments of the population.
Okay. Okay.
And can I just respond to that a little bit? I
Absolutely. Please.
Absolutely, please.
with that also. And what I find is one conversation at a time with a practitioner about their patient really there's a take hold that happens and there's an openness that happens. So I've experienced with practitioners in the hospital where I might be looking at a patient chart, or me and my students may be looking at a patient chart and happen to have the MD that's overseeing that patient sitting next to us and willing to come on and explain the details of the imaging that we're looking at. And I think that over time is how we plant the seeds of change.
Absolutely, I agree. And I would like to see more of that kind of collaboration. And we really haven't had a lot of collaboration in the past. So I think there's still more work to be done in that area, for sure.
One of the things that I think could be an effective mechanism for really bringing practitioners together would be co-rounding and really talking about the patient from the paradigm that which the practitioner comes from.
Absolutely. I agree with that.
How would you suggest kind of opening that conversation up with your physician if that's not something that they bring to you?
I think that it will become more and more prominent and more evident as there are more people, more practitioners doing CAM practices in a hospital system.
Sure.
And that conversation will carry out a little bit more, I think. And that's happening. You know, I don't know exactly the numbers of CAM providers in the hospital systems in the United States, but I know that in Minnesota, we're broaching close to 50 practitioners in the system within Minnesota. And that's significant. When we started in 1993 with, I think there were 8 of us that were in the system, in the Western medical system in 1993.
Wow. Yes, and I've seen in our hospital, you know, we have had integrative therapies, like on our oncology ward, for example, things like aromatherapy for nausea, and different kinds of aromatherapy for sleep, and massage therapists and those kinds of things in the hospital setting. But in terms of patients bringing up to practitioners, I think there's just a lot more awareness now, because you can't pass by the grocery aisle and see a magazine that doesn't talk about mind body, or doesn't talk about, you know, complementary medicine. So there's really a lot of interest in people in general, and I think our patients do bring that to us.
Sure.
So the more we know about it as practitioners, the better we're able to talk to them, and better yet, if we're doing some of these practices ourselves, we can talk about how that has benefited us personally. And I have found that to be one of the most effective ways to influence people.
Is talking about how you've actually trialed certain modalities or therapies yourself. Is that what you're saying, Doctor?
Exactly. Yes.
Barbara, would you mind, we've thrown the acronym CAM around a few times. Would you mind explaining what that stands for and what that means to our audience? And also complementary medicine, alternative medicine, integrative medicine. Can these be used interchangeably? How do you distinguish from one to the next?
Well, I don't think there's any label that calls complementary, alternative, or integrative medicine. There's no one label that describes it all. And so I think that natural medicines, if you will, or traditional medicines, if you will, are sort of get put into this pool, and there's no real titling. Titling has changed over the last 30 years incredibly. It used to be alternative medicine. And so I think the basic thought is natural medicines or traditional medicines are the medicines that fit into that classification.
And this is a question for either of you or both of you, which demographic are you noticing that it's the millennials that are looking into CAM the most, or Gen Xers, a little bit of both? I know that's kind of anecdotal, but again, just based on what you've seen and the inquiries, the age group of inquiries that you're getting.
Can I respond to that? So the basic demographic is a 40-year-old educated white female. That's sort of the demographic of who's classified as using CAM medicine or natural medicine, whatever you like to call it. But the truth is, and I think that that's because they have income that allows for that to happen. And they've had exposure maybe through education that allows for that to happen. But over the last 20 years, I've seen the Hispanic or the Hispanic population. I've seen the East African populations. I've seen the Southeast Asian populations of people really participate in utilizing natural medicines. And I think that comes from a familiarity of natural medicine, a cultural familiarity of natural medicine. I think that the accessibility to a lot of populations of people is limited based on economics, because most natural medicines are not covered by one's insurance.
Mm-hmm.
Jane, would you agree with that persona that Barbara just described?
I would say, for what my experience is, that the younger generation seems to be more open to, just because the older generation, they really grew up with a different model of medicine, and they are really, they really trust the old medicine ways, and in some ways they are not open to a lot of new ways of thinking. And so I'd say young people really are interested in how can they be healthy without needing to take medication. Now, having said that, I really believe that there are a lot of things about Western medicine that are really, really important. And that there are times when nothing else will fix a problem. And I'm so grateful. I'm grateful that we live in a place where we have access to that. So for example, I'm just going to give a shout out for the COVID vaccine. It's so important, and that people get vaccinated. And so, there are certain things that in my mind are, we really have to trust Western medicine, but keeping an openness about all the other things that contribute to our health also is important.
This is a silly question.
Okay.
Trying to figure out.
There's no silly question. Didn't your
Oh,
mother ever tell you that?
It's silly, and you both are like just so incredibly smart and knowledgeable, and I'm just like small potatoes over here. But I'm putting myself in other people's shoes and vice versa. And the two of you are talking about how there is this emerging demographic, you know, younger, late 30s, 40s, kind of cracking open the shell and pursuing what, you know, natural therapies look like, what natural therapies look like integrated with conventional therapies, which is wonderful. And it's so great that we have all of this literature. And like I was saying before, we're truly in the information age. We can look anything and everything up. It's also important to verify your resources. And anyways, I feel like there is this, my boss has, how did she, the chief, I think they call her the chief medical officer or something like that of her family, where she is in charge of her kids' health, her husband's, and also her aging parents' health. As you guys were saying, aging parents, you know, a lot of the older boomers were just, you know, they grew up with medicine and they haven't really, and I'm totally, you know, talking in broad strokes here, but as far as Eastern medicine stuff goes, for a long time, they wrote that off. And now there's, you know, there's more funding, there's more research. Of course, we have a long, long road ahead of us to go in order for it to truly be accepted. We're getting there. But I guess my question after all of that is how, and I'm just thinking about my aging parents, and they say they've exhausted their options. My mom has chronic pain, right? She's been bounced around from specialist to specialist, doctor to doctor, surgery to surgery. It's still there. She has her perceptions about Eastern medicine. And I know it's not your guys' responsibility, but I'm just wondering, how would you suggest broaching that conversation with kind of the older demographic? You know, we're all aging. Every single one of us every day. But hopefully you get my drift.
Well, I'll respond to that. I bring up the topic, and then I invite the individual to think about it and experience it from a skeptic's eye. I think it's always good to be skeptical and to really assess, does this particular modality work for me or not? And so when someone comes in and they're skeptical, I'm a little bit excited because I get to show them that they don't have to believe in a natural modality for it to work.
I like that, Barbara, because my dad is like the devil's advocate.
Yeah. Yeah. So if you can convince a skeptic, you've really done a good job.
That skeptic will sell to so many people.
Absolutely. Yeah. So, absolutely.
It's all about the quality of that conversion, right?
Yep. Is there an effect or is there not? And if there isn't, try something else.
Sure. That's so great, you two.
Well, the way I see it in answer to that question is, I would see it as like a team approach. So for example, if someone comes in with chronic pain, the most effective way is to have a team of people who's going to help them with their pain. So you might have a specialist who does an injection in their back. Then you might have a medication that you take that helps with the nerve pain. Then you might have a pain psychologist who helps you deal with the depression from the pain. And then you might have a physical therapist that teaches you some movement that's helpful for that. And then you might have an occupational therapist who is able to show you how to incorporate that into your lifestyle. So I think thinking of these modalities as part of a team approach is how I would like to view it. So you're not throwing away the Western medicine, you're not throwing away the Eastern medicine or the CAM approaches, and I don't really even call it Eastern medicine, I just call it integrative medicine, that you put it together, and that is the best and it's individual, it's different for everybody.
Right. I love that, because that's illuminating the various traits and strengths of each individual that's a part of this integrated comprehensive care plan. My next question for you two was, if either of you are familiar with, and I was kind of speaking generally earlier when I said that there isn't much funding in research. Maybe that's changed a little bit when it comes to integrative medicine. I'm wondering for those who are kind of on the fence and they're looking for data, they're looking for numbers. Are we aware of any sort of breakthrough trials or evidence of certain forms of integrative medicine that either of you can speak to?
Can you be a little more specific? So there's a lot of research on integrative medicine, right? And there's research that comes out. There was a study that came out, maybe 2017, something like that, a little while ago, but it was a CAM study or an acupuncture study on pain, general pain. And so it included neck pain, low back pain, knee pain. And it included something like 250,000 patients, and did an assessment of the effects of treatment for those particular areas of pain. And it came out very positive for CAM medicines. In terms of Chinese medicine, there's also some research that's sort of being reevaluated on the use of a couple of acupuncture points to help build white blood cells for those who are in cancer treatments. And so, yes, there's a lot of research that is coming out in different ways. And of course, in the United States, from my experience with research, we are really looking at efficacy. Rather than if I was reading research that came from China about Chinese medicine, it would already begin with the premise that Chinese medicine is effective, and actually assess maybe what herbs do in this condition, or what acupuncture does in this condition, not so much whether it's efficacious.
Jane, did you want to weigh in on that too?
Sure, I would love to. There's actually a lot of research that supports. So I noticed that there's a posting on the Benson Henry Institute. That is the Mind Body Medicine Institute at Benson Henry Institute at Harvard Medical School, and it is dedicated to the evidence-based research of how mind-body medicine works and its efficacy. And there's been so much interesting research about the relaxation response. I'll type in the name of the book. It's called The Relaxation Response, and it's by Dr. Herbert Benson. And he was a cardiologist at Harvard Medical School who showed that if you could get people out of the stress response, so that is the sympathetic nervous system fight or flight stress response, and you get them into what's called the relaxation response, you could lower their blood pressure, lower their heart rate, and there were all sorts of other cascading positive effects. And what they've done is they've really studied that and shown that these effects are present not only on a macro level, but on a microscopic level. And it affects how we respond to our immune system, the effectiveness of our immune system. It even affects how our genes are expressed. So, I mean, on a very, very molecular level. There's also a lot of research and through the American College of Lifestyle Medicine, if you could post that website, about the effectiveness of lifestyle medicine in the treatment and prevention of chronic disease, such as diabetes, hypertension, heart disease, even cancer, and why those modalities work, and explaining all of that. So there is an abundance of evidence that these things work. And it's just a matter of convincing people and showing people the evidence, and being a Western trained doctor, the evidence is important to me.
That's wonderful. And I ask because the people that I've talked to, the skeptics, Barbara, they're always, you know, when you talk about Chinese medicine and different natural health therapies, they want the data, they want the numbers, and there's always this narrative that, you know, we're still playing catch up. There still needs to be funding for these, you know, various trials and research. So, but that's great that there, you know, there's crumbs of, you know, evidence out there. There is a question that we have for Barbara that came up from our attendees. She wants to know, does chiropractic fall under the umbrella of CAM? My chiro care is covered by my insurance. Any idea if other modalities like acupuncture are starting to be covered, especially if treatments are now being offered in hospital settings?
Well, that's a multifolded question. Yes, there is insurance reimbursement for both chiropractic and for Chinese medicine. However, it's very limited and usually resides under pain or under chemotherapy-related nausea or hyperemesis gravidarum, or something on those lines. So it's very limited on what insurance will reimburse. In the hospital, there is, as it's structured right now in the United States, there's no, for a licensed practitioner other than an MD or an RN, there's no billing mechanism for Chinese medicine. And so the way that Chinese medicine is addressed in terms of that in a hospital system is that there's been some research that shows that patients actually have lower rates of fall factors, and they are generally discharged from the hospitals at a faster rate than their cohort who did not try alternative or Chinese medicine.
This is a question for both of you from the audience. This person wants to know if you can both speak to preventative care techniques that integrate natural medicine / mind body medicine specifically for younger millennials and Gen Zers.
Barb, do you want to go ahead?
I kind of want to understand that question a little bit more. If you don't mind asking it again, I'd appreciate that.
The question says, can you each speak to preventative care techniques that integrate natural medicine, specifically for younger millennials and Gen Zers?
Well, I think from my perspective, I think diet is a very relatively easy modality, if you will, to understand and to incorporate into our lifestyle because we all eat. And I think the same with movement. I think that experiencing different types of physical movement or different types of physical exercise, knowing what that individual's person likes and responds well to is another tool that you put into the toolbox. So I think that there are all kinds of modalities that work for every age group of people, depending on what the individual's preference is and what they're drawn to.
I have a couple of kids who are in their 20s, and I really feel like they benefit or would benefit from meditation, yoga, a lot of these practices that get you out of your head and the racing thoughts, and more into your body, and being able to elicit that relaxation response that I talked about earlier. So I have talked to my kids about meditation. I think it's kind of a hard sell for younger people because they're moving so fast. But I do think that's something that is very beneficial, just to be able to slow down, to be able to take a moment, take a breath, get away from the social media, get away from the phone, and just get grounded again.
I have a daughter who's 30, and she was raised with a mother who practiced Chinese medicine. And from the time she was really young, I did a guided meditation with her, and a guided meditation that was both physical and that was inactive physically. And my 30-year-old still comes to my house and says, "Would you walk me through that meditation?"
You're
That's
kidding.
so wonderful.
That's great,
See
Barbara.
the influence that you have, Barb, it's lasting.
Yeah.
And these are practices that people can bring with them. You know, it's like, you know, you teach them and they can do it, and then they can bring it home, and then they have it in their own toolkit. They don't need you necessarily anymore, although I'm sure your voice and your presence adds so much to that.
And one of the things that she has done, she's a Montessori teacher. And she, in her classroom, takes in yoga and guided meditation and breath work to her students.
That's fabulous.
Isn't that a wonderful little transition of generation?
It is. And I think, you know, that's a great place to use these things, like in the schools. My neighbor across the street, she's a math teacher in a high school, and she said that she starts her classes with like a 5-minute meditation.
Wow.
And then at the, you know, by the time they're done with that 5-minute meditation, they're much more settled and able to learn. So I think these practices like this can be used in so many different settings, and it's pretty universal. And the younger people learn it, the better, in my mind. I wish I had learned about this when I was a child. This would have saved me a lot of grief.
Yeah. I keep thinking about Toolbox. Was that you, Barb, that brought up Toolbox? This is another one of those things. My introduction to, so I've never been, or I always say, I'm not a yoga, I'm not a meditative, meditation person. I want to get my butt whooped in boot camp, and then I feel good after that. But, there are benefits to both things. And I did do a guided meditation that was on Facebook Live. That was my introduction to it. And it was specifically for people that have experienced grief. And that was for the loss of a family member. But I think that's a scalable thing when you consider how the past year and a half have gone. We're all mourning different facets and different parts of the lives that we used to have or lead. And I was so skeptical. All right, is this like I've got 30 minutes. Time is money, money is time. This better do things. And it was so therapeutic.
Absolutely.
And anytime that I am in a place where I just feel like I can't be grounded or find my center, that's what I do. All you need sometimes is like was it you, Jane, that was saying with the 5 minutes, or the 5 minutes that the teacher allows in the classroom. I mean, that's skills for a lifetime. Yeah. We have just a few minutes left for our audience members out there. If you have any questions, now is your chance. I have one last question that I wanted to, well, I have several questions, but we don't have time. So I thought I would kind of pick and choose, but we were talking about how we are living in this state of chronic stress. Fight or flight is, that's something that's evolutionary that our ancestors had. And now we're kind of just in that mode in sort of a permanent way. And that's not good.
Mhm.
But also, how else do you sort of deal, given sort of the climate right now, and all the change,
Mhm.
massive change that we've undergone over the past year and a half. My question for both of you was, we're feeling extremely fatigued right now in body, in mind, in soul. This really has been traumatic.
Mhm.
This is trauma that we've gone through. What types of therapies or practices would work best for this condition? I feel like anyone and everyone can kind of relate to this.
Mhm.
Do you want to go first, Jane?
Sure. I'm going to keep going back to my same mantra, which is that of meditation and connection. Social connection is very important. Staying connected with people however you can. And one of the things that we've learned through this pandemic is how important that is. But also just finding techniques that are grounding, whether it's going for a run, walking outside, talking to a friend on the phone. Those are the things I would recommend. And these are things that I try to do in my own life to help me cope with the stress.
And I would add into that breathing, really mindful, purposeful breathing. And for me, I probably take a minute or two out every day, almost in every environment that I'm in, and focus on my breath and where is my breath stuck and how can I open it. And for me, that is a very, very grounding technique.
Absolutely. The breath is so powerful. And when you use it in a way that's purposeful, it can really, really help.
Mhm.
I just want to jump in here really quick before we sign off. We got a question from our audience, and Rachel wants to know, we're talking about meditation, we're talking about yoga, exercise. How often are you recommending that a patient do these, all on a daily basis? Please elaborate.
Boy, your day is going to be really full if you try to do all that.
It sounds like a lot.
They are.
I would say, do what you can. If it's 5 minutes here, 5 minutes there, if it's a mindful breath before you go in, like Barb said, before you go into a stressful meeting, just take a moment. I like to use meditation apps. I have an app that I use on my phone so that when I'm in a place where I can just put in my earbuds for 5 minutes, sometimes I use it before I go to bed. So if you can do it every day, yes, but whenever you can, you'll get the benefit.
And I'd say practice, jump in and see what works for you, and then utilize those, put them in your toolbox and take them out. You'll find that the more tools you have in there, you can tap in for all kinds of different reasons. And some tool might work for one reason where another would work for something else.
Right. You can just kind of push yourself into those practices.
Mhm.
Even a 5-minute walk can just do a number on your immune system, your mental health.
Absolutely.
You can't underestimate the power of a good old-fashioned stroll around the block.
That's right. Especially when we're all sitting in our home offices and,
Right. Well, that's about all the time that we have for today. It's
Mhm.
1:01. This hour went super fast.
Good.
Like it always does. I just feel such a boost in my mood and in my energy being surrounded by like strong, smart, kick-ass females like the two of you. Use my language kind of came out, but that's just how I feel.
Thank you.
I know how busy you two are, and there's so much wisdom that we've gleaned today. I've taken so many notes. I'm sure that our audience would say the same. So thank you, Jane. Thank you, Barbara. If our audience happens to have any specific questions for either of you, is it okay if we reach out?
Absolutely.
Okay, because there's normally some follow-up questions that I
Sure.
get asked. sessions. And then for those of you who may have missed parts of this, just because the noon hour is typically pretty busy, this is being recorded. This will be on YouTube. So go back to the landing page, that Wellness Wednesday page, within the next day or so, and you'll find the full recording of the webinar there. And then while you're there, you can see we have sort of a little roster of upcoming topics. Next month is touch therapies as immune boosters, since we are kind of edging into that fall time. So that'll be a good one. October's hormones, then we're talking about Ayurvedic medicine and so on and so forth. So we've got some really good stuff in the works. And yeah, just want to give a major thanks to Park Nicollet, Northwestern Health Sciences, and then for Northwestern for sponsoring this great series. Don't forget to sign up for next month. Our door is always open. So just let us know what you want to hear about when it comes to the world of natural healthcare. Thanks so much, the two of you.
Thank you.
Take care, Jane. Take
Bye.
care.
Thank you. Bye, Barb. Nice to meet you.
Nice to meet you.
Bye.
Yep. Take
Bye,
care.
everyone.
Bye-bye.